Scenario: a 55-year-old female presents with severe epigastric pain radiating to the back, nausea, and vomiting. Laboratory tests show elevated serum amylase and lipase levels. Abdominal ultrasound reveals gallstones and a dilated common bile duct. What is the most appropriate next step in management? A. Cholecystectomy during the same hospitalization. B. ERCP with sphincterotomy. C. Conservative management with IV fluids and pain control. D. Endoscopic ultrasound, EUS. Answer: B. ERCP with sphincterotomy. Explanation: in cases of acute biliary pancreatitis with evidence of common bile duct (CBD) stones, early endoscopic retrograde cholangiopancreatography (ERCP) with sphincterotomy is recommended to facilitate stone extraction and relieve biliary obstruction, thereby reducing the risk of recurrent pancreatitis. Scenario: a 30-year-old male involved in a motor vehicle accident presents with decreased level of consciousness and signs of head trauma. Abdominal examination reveals tenderness and guarding. What is the most appropriate initial management priority? A. Emergent neurosurgical intervention. B. Emergent laparotomy. C. CT scan of the head and abdomen. D. Intubation and mechanical ventilation. Answer: D. Intubation and mechanical ventilation. Explanation: in patients with traumatic brain injury and potential concomitant abdominal injuries, the initial priority is to ensure airway protection and adequate oxygenation by securing the airway with endotracheal intubation and initiating mechanical ventilation. This helps prevent hypoxia and secondary brain injury. Scenario: a 45-year-old female with a history of pneumonia presents with fever, pleuritic chest pain, and dyspnea. Chest X-ray shows a large pleural effusion with loculations. Thoracentesis reveals turbid fluid with elevated white blood cell count and low glucose levels. What is the most appropriate next step in management? A. Tube thoracostomy drainage. B. Antibiotic therapy alone. C. Thoracoscopic decortication. D. Observation and serial imaging. Answer: C. Thoracoscopic decortication. Explanation: in cases of complicated parapneumonic effusion with loculations and evidence of empyema, thoracoscopic decortication is the preferred surgical intervention to break up loculations, remove fibrinopurulent debris, and promote lung re-expansion. Scenario: a 30-year-old male presents with a tender, irreducible mass in the right groin. On examination, the mass is erythematous and firm. Vital signs show tachycardia and mild fever. What is the most appropriate next step in management? A. Emergent hernia reduction. B. Emergent laparotomy. C. Intravenous antibiotics and observation. D. CT scan of the abdomen and pelvis. Answer: B. Emergent laparotomy. Explanation: in cases of strangulated inguinal hernia with signs of bowel ischemia or perforation, emergent laparotomy is indicated to assess the viability of the incarcerated bowel, perform bowel resection if necessary, and repair the hernia defect.